Okay, so now I'm going to take a look. I'm gonna watch. I'm gonna take a look here and make sure Aubrey's still, you doing okay? Perfect. All right, so Aubrey, if I could have you lay down, please. The next thing I'm going to assess is her cardiovascular system. So the first thing that I'm going to do here is I am going to look for any pulsations or see if I see any bounding areas. In this case, I am not. I'm checking over her abdomen right now, and I'm seeing a nice flat abdomen. I don't see any pulsing on her body, which in a lean person would be a normal finding. All right, Aubrey, so the first thing that I'm going to do is I'm going to feel for your carotid artery. Just feel your pulse. And I'm going to make sure that I do this one at a time so I don't do any carotid massage. Okay, that's perfect. All right, now I'm going to come over here and I'm just going to feel at the second intercostal space, the right sternal border, which will give me her aortic valve. Then going to the left sternal border, I can feel the pulmonic valve. Coming down a little bit, we can find Erb's point. And I would give that a 2+. Okay. And coming down to the fourth intercostal space, I am feeling now for her tricuspid valve. And for the fifth intercostal space, which would be the mitral valve. All right. Perfect. Now I'm going to take a listen, Aubrey, to everything that I just felt. Now I'm going to begin by listening for and assessing for a carotid bruit, listening for that swish. And I don't hear that. Okay, listening on the other side, I don't hear that either. Now I'm using my bell to listen again at that second intercostal space. The right sternal border, I'm starting off with the aortic valve, and I'm going to move over to the left sternal border, listening for that pulmonic, coming down to Erb's point. Perfect. Okay, going to go slightly over there to the fourth intercostal space, and I'm going to listen to the tricuspid. Now I'm going to come over mid-clavicular line on that fifth intercostal space and listen to the tricuspid. All right. Now I'm going to switch it over and I'm going to listen to the diaphragm, working my way back up. So I have mitral, tricuspid, Erb's, pulmonic, all right, Aubrey, may I lift your shirt up just a little bit? Okay, perfect. If you would do that, that would be great. Thank you so much. All right, now I'm going to look for the abdominal aorta. And what I'm looking for here is it's halfway between the xiphoid process and the umbilicus, and a little bit slightly further down. So kind of listen right there. Perfect. Now I'm just going to go about a 45-degree angle to listen to the renal. Okay, perfect. All right, I'm going to start by assessing the abdomen. I'm just going to begin by inspection first. So I'm taking a look at her abdomen. It looks like it's nice and soft. It's not distended. She doesn't appear to be in any distress. I'm not seeing any trills or any problems there. Looking again at all four quadrants, we have right upper, left lower, and the right lower quadrant. I'm just going to take a listen to Aubrey's bowel tones. Okay, and I hear bowel tones in all four quadrants. If I hadn't heard anything, I would listen for a full 5 minutes to assess for them. I hear them quite nicely. All right, Aubrey, what I'm going to do now is I'm going to begin by just lightly touching your stomach. I want you to tell me if you're experiencing any pain. So I'm going to start right up here in this right upper quadrant.
No.
Okay.
No. No.
Okay.
No.
All right. Now I'm going to have Aubrey take a nice deep breath for me, and that is when I'm going to probe. Okay. And again, I'm paying special attention to Aubrey's face. I want to make sure she's not having any problems here. All right, perfect. So the things that I'm looking for when I'm palpating is I'm going to go in all 4 quadrants. So in here and in here, we could feel on a lady, it would be her ovaries as well as her bladder. On this side, we are going to feel the colon. And up in here, we can feel the liver. And we can possibly feel, if we were to lift up this left rib cage just a little bit, we could feel under there and possibly feel her spleen. I don't feel any masses or any of the organs, so I'm thinking everything looks good right there. All right, Aubrey, you can go ahead. What I'm going to do right now, Aubrey, is I would like to take and feel your femoral pulses. Now, those are in a very sensitive area. Would it be okay if I touch them? Okay, thank you. Oh, thank you. All right. Thank you very much. Aubrey, can I just feel right here? I'm going to feel your pulses right here. 2+, nice and strong. Going to come down here. Feel the posterior tips and the dorsalis pedis. And all of those are 2+. All right, Aubrey, now what I'm going to do is I'm going to pull up your pant leg here. I'm just going to look for any bruises. Looks like you have a little bit of bruising on this knee. Any pain? No? Okay, perfect. So what I'm going to do is I'm going to have Aubrey lift her leg straight up. All right, now I'm going to have her push against my hand. Perfect, so flex. Now, bring it back toward you. Extend. Bring it back. Any pain? No? Okay, perfect. I'm going to have you bend your knee. Now I want you to push against me. Push, perfect. Now, push upwards. All right, now here I'm also going to bring it internally rotated. And I'm going to externally rotate. Oh, looks like you're pretty loosey-goosey. I'm going to hold this leg out, bring it out, and take it in. Abduction and adduction, checking for that range of motion and the musculoskeletal. Now, we're going to do the same thing with this leg. I'm going to take a look here. Getting a little bit more bruising on the legs. All right, Aubrey. If I could have you bring this leg all the way up. Push against my hand. Okay. Bring it back. Perfect. Bend your knee, please. Now push against my hand. All right, now push against the hand on top of your knee. Perfect. All right, Aubrey, I'm going to externally rotate and internally rotate. Perfect. I'm going to bring that knee straight. Wow. Going to bring it in. Adduction and abduction. Going out. Okay, perfect. Aubrey, can I have you push down on my hand? And push down on this hand. Okay, how about you bring him up? All right, if you want to take a seat and sit up. Now I'm going to check for reflexes. So what we're going to do here is you look for the landmark. You just go right underneath the patella to find the posterior and the tibialis there. Oh, there we go. All right. Perfect. All right, Aubrey, I'm going to do the same thing down here. I want you to push down on my hand just a little teeny bit. Okay, perfect. She flexed downward. Okay. So I would give her a 2 on those reflexes. That's perfect. All right, Aubrey, what I want you to do is put those arms out to the side. I'm going to have you close your eyes. Now, I want you to touch the finger that I touched to your nose. Okay. All right, perfect. So her sense of proprioception is perfect. I want you to bring those hands in front of you, palms down, up, up. Perfect. All right, Aubrey, now what I want you to do is I want you to push your hands against mine, push me away. Okay, Aubrey, I want you to bring me toward you. All right, now squeeze as hard as you can. Oh, wow, very hard. All right, open those hands out. I'm going to try to squeeze your fingers together. Don't let me. Okay. All right, perfect. Aubrey, I want you to bring your arms up like this. Okay, push against me. Now bring me toward you. All right, Aubrey, what I want you to do is I want you to do a backstroke. Okay. As much as you can. Okay, perfect. Give yourself a big hug. Perfect. I would like for you to look over one shoulder. Look over your other shoulder. All right, perfect. Any problems there, Aubrey? All right. If you would like to stand up. Now, what I'm going to have you do right now is I'm going to check for scoliosis. So what I'm going to have her do is I want you to bend over, touch your toes. Now I'm just going to slide my hands down the spine. I'm not seeing any anterior, posterior curvature of the spine. All right, Aubrey, bring it back up. All right, looks good. Okay, Aubrey, I want you to do that one more time, and then I'm going to looking for any lordosis or kyphosis, and I'm not seeing any. Go ahead and stand up for me, sweetie. Okay, perfect. All right, Aubrey, now what I would like for you to do is I want you to walk on your tippy toes. Okay, come back toward me. Now walk on your heels. Okay, now can you do a heel-toe walk? Okay, perfect. Now if you just want to walk toward me normally. All right, it looks like that gait looks perfect. So that was an assessment of the spinal accessory muscles, as well as taking a look at her range of motion and the musculoskeletal. I would like to say thank you. Again, my name is Heather Hollick, and this is Nursing 360, and this was my physical examination. Thank you so much.